Good morning. Welcome to the State of Homelessness Address 2020, live from Dallas, Texas. Thank you all for joining us. Obviously, in these times, we had to change our scenario a little bit here for you, but we wanted to make sure that you had the information from the State of Homelessness Address. And so we are happy to have you here and welcome again. In the past State of Homelessness addresses, we've opened with a welcome from our board chair. Karen Hughes, our current board chair, asked me to read this on her behalf today. Welcome everyone to our 6th annual State of Homelessness address. The State of Homelessness address, though relatively young, has become a tradition in our community. The address, which usually attracts between 300 and 500 people, covers the results of the annual homeless count, a thorough review of progress of Dallas's homeless response system, and the next steps the community must take to end homelessness. This year, due to the COVID-19 pandemic, we will all experience the address a little differently. It was not easy to reconfigure what is usually a mass gathering into a virtual event in such a short amount of time, but we were determined to still hold it. If anything, the address this year may be more important than all the previous ones. For as we retreat from the public square and seclude ourselves within our homes, there are those who cannot. The men, the women, and the children of our community who are experiencing homelessness. I want to say thank you to all of our service providers for tirelessly working day in and day out to end homelessness, and in these very days to keep their guests safe and healthy. I want to thank our homeless count volunteers, for without all 1,750 of you, this event would never happen. I want to thank our homeless friends for sharing the lessons of lived experience with us. And finally, I want to thank our staff and board for all of your hard work and support in developing and leading our homeless response system. This pandemic has clarified what we already knew and has only added urgency to our solemn task. We must make homelessness in Dallas and Collin counties rare, brief, and non-recurring. That from Karen Hughes, our COC board chair. Next, I would like to thank United Way of Metropolitan Dallas, our presenting sponsor. And I would like to read a few words from Ashley Brundage of United Way, who could not be here based on the COVID-19 situation. Friends and colleagues, I am thinking of each of you and your families during these uncertain times. I wish you wellness and comfort. United Way leads the charge to improve education, income, and health, the building blocks of opportunity. United Way believes that access to safe, quality, affordable housing and the supports necessary to maintain that housing constitute one of the most basic and powerful social determinants of health, education, and future income. To that end, we have launched our new Housing and Homelessness Initiative that incorporates programming to prevent evictions and house chronically homeless individuals, as well as a funders collaborative to increase and maintain affordable housing. United Way is also in development of a funders coalition to end homelessness across our community. I also want to announce the development of United Way's Coronavirus Relief Fund to address the immediate and long-term needs of North Texans impacted by coronavirus. Please watch our social media outlets for more information as it is available. United Way, along with Metro Dallas Homeless Alliance, and many of you with us today, believes that we can end homelessness with coordinated strategic investments in effective housing-based solutions. United Way's mission is to improve the lives of all North Texans, and that includes housing our most vulnerable. Again, we want to thank United Way of Metropolitan Dallas for their generous support today. Thank you. We also want to thank our supporting sponsors, Downtown Dallas Inc., the Thomas Knight Foundation, Court Furniture, and KDC Developers. We also want to thank our event sponsors, Children's Health, Congregation Sharith Israel, Daniel Roby, Ellen Magnus, Promise House, St. Matthew's Cathedral, Temple Emmanuel, the Salvation Army, and the Vogel Alcove. Metro Dallas Homeless Alliance is a continuum of care lead agency for Dallas and Collin counties. We lead the homeless response team, or homeless response system in our area. Our mission is to lead the development of an effective homeless response system that will make the experience of homelessness in Dallas and Collin counties rare, brief, and non-recurring. Our vision is to end homelessness and be the best continuum of care in the country. The purpose of the State of Homelessness Address each year is fourfold. Number one, to collectively review data and derive knowledge about that nature and the extent of homelessness. To give an honest assessment of our system and our progress toward ending homelessness. To inform our decisions and to move forward to build an effective homeless response system. And finally, to continue a discussion that leads to new ideas and insights from all persons on how we can make homelessness rare, brief, and non-recurring in our community. And finally, to the State of the Homelessness Address 2020 point in time count, the moment that most of you have been waiting for. I know I've been waiting to release these results for quite some time. That's why I'm trying to keep you all in just a little more suspense for just a few more seconds. Hopefully it's working and you're still there. Our point in time count. The point in time count for this year showed an increase in unsheltered homelessness of 11.5% from 1,452 individuals and families to 1,619. It showed a decrease in emergency sheltered homelessness from 2,313 persons counted to 1,938 persons counted. The safe haven results were the same, and the transitional housing results went up slightly with increased bed capacity, leaving us with a total of 4,471 individuals counted on this snapshot in January for the point in time count. The change from last year is a decrease of 1.4%. With that said, now's the time for us to do one of two things. We can either celebrate, yay, we've done it, we've decreased homelessness, or we can see this as hope, as power, as a way to look forward to the future. I am inclined to look at the second. I think we should take a moment first, and I want to say thank you. I want to say thank you to all of our homeless providers. I want to say thank you to all of the volunteers who helped us with the point in time count. I want to say thank you to every single person who has made this happen. The homeless response system, the reason that homelessness has gone down in Dallas and Collin County this year is because of the workers and the clients and individuals who are working in our homeless response system. Our peer specialists, our case managers, our counselors, our outreach teams, our program managers, our directors, everyone that's part of the system has made this happen. This is not an MDHA thing. This is a community thing, and we should be proud of where we are. We effectively lowered our trend 10.4 percentage points in the last year. This year's count, like the last 2 years' count, could have easily been at a 9% increase again. It is not. It is down, and that is thank you to all of you out there doing the hard work. We appreciate the partnerships of the community, the elected officials, and everybody else who has had a part in helping us bring down the homeless numbers. Now let's look more closely at what the numbers tell us and where we go from here. The methodology for the unsheltered homeless count this year, the count was conducted on Thursday, January 23rd, 2020 at approximately 8 p.m. with the temperatures in the 50s. This is a clear departure from the last 2 years that have been decidedly colder. In some cases, actually, we opened up inclement weather shelters, and it is, in fact, one of the reasons we think that the shift in the count went from the sheltered population to the unsheltered population is because that we did not have as many shelters open on the night of the count. Continued improvement in the coverage area came with this year's count. We had 1,715 volunteers, the most that we've had in any previous point in time count, and we covered more area than we ever have in our point in time count, which means we're getting more accurate. We're getting better at this. We're getting better at understanding what we need to do for the count and how we need to do this count more effectively. We use the Counting Us smart device app, and it was fully adopted using GPS mapping and survey across all of our areas. GIS generated maps for volunteers' assignments and documented coverage areas, so we were able to make sure that we covered as many areas as we possibly could on the evening of January 23rd. The data was finally analyzed and it was deduplicated based off of the information that we received from the Counting Us app. In the 2020 Unsheltered Survey data source gives us a lot more information. As you can see, the interviews that came from the unsheltered population grew this year, and actually we got most of our data, 58% of our data, from interviews rather than observations. What does this mean for our population and for our area? What this means is that we are getting more accurate information. The more interviews we can do, and the less observations we do as part of our point in time count means that we can be more accurate. We can get better information. And we appreciate, again, the efforts of the volunteers to not just find individuals that were homeless, but to actually try to interview them and talk to them and learn about their stories. The methodology for the sheltered homeless count came through HMIS system and Counting Us reports from 53 emergency shelters, safe haven, and transitional housing agencies across our system. The Counting Us Excel template was used for 16 non-HMIS user agencies and domestic violence providers. Deduplication of the analysis was used against other sheltered data and the unsheltered data to make sure that we had the most accurate count that we possibly could for our area. Nationally, we've seen a rise in homelessness. According to the 2019 HUD Annual Homeless Assessment Report, which was released in January, homelessness increased in 2019 for the third year in a row across the country. There was a 3% increase in homelessness, and roughly 568,000 people are homeless nationally across our country today. 63% of those are sheltered, and 37% of those were unsheltered. In terms of the unsheltered homeless population by city in Dallas County, you can see that the majority of the individuals that were counted in this year's homeless count were from the city proper of Dallas. We actually had an increase of 122 individuals in that area. But you can also see some interesting information from the statistics here. You see that there were increases in places like Grand Prairie and Irving and Mesquite, Balch Springs. But there were decreases in Garland and Farmers Branch and Carrollton and Addison. What this means is that people were moving around. And because the unsheltered population increased this year, it means that we're moving people out on the streets rather than getting them into housing. When you look at the unsheltered homeless population by city in Collin County, we see that there was actually an increase almost across the board for most of the large areas in Collin County. Plano had an increase of 46 individuals counted. McKinney had an increase of 67 people counted in these areas. Now, granted, these areas are newer to the homeless population, and so some of the increase there may have just been from increased effectiveness of the point in time count. But we'll talk about some of that a little bit later as we get into it. The gender of the unsheltered homeless count is about the same as it always has been trending. The men make up 76% of homelessness for the unsheltered population, and women make up 24%, with the transgender population making up less than 1% of the population. The ages of the unsheltered population, what we see here is we see that some things are working and some things are not working for certain segments of our population. The 25 to 34 and 45 to 54 age ranges decreased this year. Again, going down from the trend that they were moving towards, which means there are some services that are working for those populations that were not working previously for them. But then we look at the 35 to 44 and the 55 to 61 populations, and we see those age ranges, and we see that the trends continue in almost the same direction they were previously. In 2020, the race of the unsheltered homeless population was 47% Black and 39% white, which again shows a predominantly overrepresentation of people that are Black in our homeless population overall. Households with children during the point in time count, as you can see, we have it broken down to the unsheltered, the emergency shelters, and transitional housing. You can see that overall, the total number of persons and families was 918 that were counted this year, and 57 unaccompanied youth. Total homeless children this year were 662. But overall, the homeless population, 14.8% of the homeless population are children that were under 18 years old. But overall, the total count for the families is actually down from last year. Homeless veterans. This year, we saw a decrease in the population of homeless veterans. And we'll talk more about why we think that occurred as we go into more of the presentation. But as you can see, we identified 354 individuals who reported to be veterans this year, and 14 who reported to be veterans that were in families, for a total of 368 veterans, 77 of which also were identified as being chronically homeless veterans. So we saw a decrease of 1.7% in the homeless population of individuals who reported to be veterans for the year 2020. Chronically homeless. For those of you that are unfamiliar with the term chronically homeless, what that means is, by definition, it's homeless at least 1 year, or homeless 4 or more times in the last 3 years, where the cumulative time homeless is at least 1 year. And they possess a documented disabling condition. So let's look at the chronically homeless population for the point in time count. The chronically homeless population this year for individuals was 485 individuals counted, and 18 that were part of family units, which leads us to a total of 503 chronically homeless individuals counted during this year's point in time count. That, in fact, is an increase. It's up by 0.9% from 2019, with 11.2% of the total population counted as chronically homeless in 2020. Now I want to take some time to go over some slides from Family Gateway. I want to thank Ellen Magnus and all of the workers at Family Gateway who have done an amazing job as an access point for our families to enter our homeless response system. And this is the information that they compiled at their location and through their access point over 2019. They received 4,600 total calls. 2,700 of them were full pre-screenings, and 700 calls were quickly helped on the first call with a referral to another appropriate resource or access point. 1,600 of the families identified met the definition of homelessness of those that called in over the course of the year. And you'll notice that 750 of the families were diverted from shelter. We'll get into diversion in a little bit. 550 families were triaged to shelter, overflow, or hotel, and 300 families opted not to seek full assessment services and were assumed to be self-resolved. Now, Carl, why do you have circles around some of these numbers? And why are some of these numbers green? It's because these are good things. These are positive things that we're seeing. And this is one of the reasons, I'm almost 100% sure that this is one of the reasons why homeless families were counted as lower this year in our homeless population. It's because of diversion. Diversion is a tool, it's a model that is used to make sure that we are taking in people that are appropriate to services that we have in the homeless response system, but that we are also making sure that we're reaching out to people while they are still housed, or while they have the opportunity to still be housed, while they have a friend, a family, any type of support network that is still in the community that they can use. We are trying to connect them to those resources so they don't have to come into the homeless response system. And as you can see here, they have effectively started doing this at Family Gateway. The length of stay in shelter ranged from 7 to 365 days overall, but the average length of stay in their emergency shelter for families was 69 days. That's actually pretty good. That's actually pretty good. It means that they can help 6 families in a year, or approximately 6 different families access housing or move to appropriate services over the course of a year. The shortest stays were associated with exits to rapid rehousing. And that is another program that they have implemented at Family Gateway, which it looks like is being successful for some of the families that are coming through their programs. The percentage of families exiting from shelter into positive housing was 69%. That's a pretty good exit destination percentage. 55% of Family Gateway's families increased their income during their supportive housing stay, which is fantastic considering, as you'll see later in further slides, our system overall is not doing a great job of increasing family or individual income. 99% of Family Gateway families served in supportive housing remained stably housed. And that is just phenomenal. It's phenomenal to know that not only is Gateway diverting people who don't need the services that we're providing from the system and helping them in other ways, but they're also getting them out quickly, and they're getting them stable quickly, they're increasing their income, and they're keeping them in housing. I want to say thank you to the Family Gateway staff and all of the hard work they're doing. These are examples of things that work in our system and why homelessness has decreased this year. But we're not done yet. And some would say there's a wave coming. Some would say that there are a lot of people out there in the community who could be homeless or are almost homeless at this point. So we gathered a few data points and a little bit of information to try and talk about that population, because we are certainly not done. We have not ended homelessness yet. Dallas and Collin County Independent School Districts report 6,058 kids in this last school year in families that are doubled up. For those of you who are unfamiliar with the term doubled up, it just means that they were living in situations, in apartments, in homes with other families or other family members where it was, I would say, inappropriate for them to be based on the size of their family and the space that they have available. But at least they were still housed. But the reality is there one emergency, one car breakdown, one medical emergency away from becoming homeless or losing even their temporary situation. The Child Poverty Action Lab released a Housing in Dallas report, and these are some of the other statistics that show us that we have got to work on making sure that everyone does not become homeless in the next year. A minimum wage worker paying fair market rent for a one-bedroom apartment right now will pay approximately 87% of his or her income for rent. In 2016 in Dallas, there were 4,345 evictions, or almost 12 a day. Between 2008 and 2018, there was a 42% decline in low rent units being available in our community, and that's below $800 a month, which means people are barely hanging on. We have a large population of families and individuals who are in our community right now struggling to hold on to the very last vestige of housing that they have available to them, regardless of how good it is or regardless of how bad the situation is that they're in. So we are not done yet. Now I want to take some time to talk about the system analysis and performance, things that we've looked at in our system and things that we think are some data that can be useful to us, at least to begin more conversations in 2020 and start to develop more specific plans about how we'll end homelessness. The first housing needs assessment that I've done was a housing needs assessment that I did last year, and it shows that transitional housing this year, our current capacity is 1,128 units, with the number of people not served annually being 0, meaning that right now it looks like in our system we have enough to serve the people who need transitional housing at this moment. Again, it's not a day-to-day. This is a snapshot as well. This needs assessment says today, this is what it looks like to us. It does not mean that there are not people who don't need transitional housing. It means that right now, our current capacity looks like it meets with most of the trends that we're seeing. For rapid rehousing, it's a little different scale. Again, we've increased our capacity a little bit, 423 units, up from last year where we had just over 300 units. And now the number of people that are not served annually would be 2,100 as of today. Again, it's a snapshot of our system and it talks to us about where we're going. Now, the question that some people might ask and may be writing into Facebook right now, as a matter of fact, with questions that you can ask for later. Question may be asked is, Carl, we didn't add that many rapid rehousing units, so why did our number go from 4,000 down to 2,100? Surely that small amount of rapid rehousing units didn't cause that big of a drop. No, it's true. I don't think it was just rapid rehousing alone. I think rapid rehousing had something to do with it, and it helped us with certain subpopulations of our homeless individuals, and it certainly moved more people out into housing. But I think the other things that we've looked at already, some of the things like diversion and some of the things like other programs that we have in place, have helped lower those numbers. And so the number of people not served annually is not just indicative of rapid rehousing, but also indicative of everything that we've put in place and how we're moving towards ending homelessness now. For permanent supportive housing, our current capacity is about 3,000 or just over 3,000. and the number of people not served annually is about 1,764. This is an area where we moved some resources away from in previous years, and I think it's time to take another look at the permanent supportive housing units that we have. It's time to look at maybe adding back some permanent supportive housing units, or looking at how we balance that with knowing that we have to have a full mix of services and housing available for our individuals in our community. The continuum of care system performance. So I'm going to pull an old Western out of my hat, so to speak, today, and go with the good, the bad, and the ugly. Let's start with the good first. These are system performance measurements that HUD requires of us every year, and they run from fiscal year, the fiscal year here is October 1st to September 30th, which is why we have fiscal year 17-18 and fiscal year 18-19. What I wanted to do though was give you an idea of the trend of how things are moving in that direction. We won't know what we've done in fiscal year 19-20, which is where we are currently, until September 30th of 2020. But if you look at the numbers and you look at how it's trending, there are some positives here. There are some system performance measures that we are improving on. The number of persons who entered the system as first-time homeless actually decreased during the 18-19 fiscal year. And that, I think, is indicative of diversion methods, of making sure that we have the appropriate people in our systems and helping them where we can before they become homeless. That, I think, is indicative of that number. Exits to permanent housing destinations from street outreach. We can see that street outreach workers are working harder and harder to make referrals directly from the street. That increased by 262 referrals over the previous year's referrals. This is a positive. We want street outreach workers to make more increases, to make more referrals, to get more people into housing, even if they have to do it directly from the streets. And then finally, our exits to permanent housing destinations, again over the year, increased by 3%, but we're still very low at 19%. And we have to increase that number dramatically if we want to make sure and have real system change. Then we get to the bad and the ugly. We look at the ugly first, and the total persons served during fiscal year 18-19 as opposed to 17-18 increased by 1,401 individuals. Again, this is while doing diversion. This is while moving people out of our system. This is while we're trying to do prevention activities. The numbers still increased. And if you'll remember going back to that almost slide, it means that there are still people out there. There are still people out there who are barely hanging on. And we've got to acknowledge that they're still there, and we've got to figure out ways to work with our partners in the communities to help them as well as our homeless populations. Exit or stayed in permanent housing, that dropped by 8 percentage points from 17-18 to 18-19. We think we have better ideas about how to do this better now in 19-20, but we have to turn this around. We have to make sure that people are exiting to permanent housing. We've got to make sure that we're keeping people in our system, we're referring them to appropriate resources, and we're making sure that they maintain and stay in the housing that we're giving them. And then just the bad, I guess just the bad, change in earned income for the adult leavers, the people who left our system, was at a 0% or a flat rate. We're not increasing people's income either for the leavers or the stayers. That's a term that HUD uses to determine between people who leave our homeless response system, graduate, move on, whatever the case is, and people who are still in our system in programs like permanent supportive housing, which are longer term programs. In both cases, we are not increasing earned income. It's not going up. And we have got to find a way to increase the income of the individuals and families that are in our system. It's the only way that we will end homelessness, is to help them increase their income. So what do we know? What have we gleaned? I've thrown a lot of statistics at you. I'm sure you have a lot of questions about them. And I'll take this moment for 1 second to also let you know that this year we're going to do an annual report based off the State of the Homelessness Address. And so we're going to make it a little more in depth. I'm hoping to have that finished and published by June of this year. We're going to get more in depth with each of these details. People ask me questions all the time. Hey, Carl, how many, homeless individuals are, 13 to 15 years old, or how many homeless individuals are, have this income range from $400 to $500 a month, or whatever the case is. We're going to try and get down to some of those more really nitty-gritty details of this in the annual report that we're going to publish in June. But for right now, what do we know? Well, the first thing we know is that we have a new homeless management information system. Last year, we made the decision to change our homeless management information system. For those of you that are unfamiliar, this is where we collect data on homeless individuals and families in our homeless response system. This is where we analyze that data. This is where we try to get as much information as we possibly can to make the most appropriate connections for individuals that are homeless to the services that they receive. So we moved from our previous HMIS system to the new system, which is called Client Track. This system, in June of 2019, we signed a contract with Client Track to change to their new system. We started the system transition in July of 2019. We actually went live with the system in November of 2019. And to all of you programmers out there or technical people who understand all the technical jargon about data and systems change and things like that, particularly with information systems, yes, July to November was a real struggle making a system change that quickly. You don't just shut down an entire system that has well over 300 users and move to another system the next day. It was definitely a challenge, and I want to give credit to our HMIS staff that are out there watching this webcast and making sure that they know that we really appreciate their efforts in making this transition. We went live, like I said, in November 2019. We trained over 300 HMIS users to the new system. Some were previous users, some were new users to our system and to HMIS overall. And our next step is to put our coordinated access system or our coordinated entry system into the HMIS system so that we can make it as seamless and effective as possible. Again, for those of you out there who don't know about the coordinated access or coordinated entry system, it's essentially, if you think of a hospital, it's the emergency room. It's a place where people get triaged and prioritized, and we do assessments and we do intakes of people to ensure that they get the most appropriate resource they possibly can when they come into our homeless response system. And we're kicking that off. It's actually already started January 2020, and we're working on that right now to be able to add that system into our homeless management information system to make it as effective as possible. What else do we know? Well, we know 4,471 people were homeless on the night of the count and are homeless on any one night, sheltered and unsheltered. It's far too many people. It's far too many people to be out there. One of the things about the coronavirus, that pandemic that has been going on, that I keep seeing in guidance over and over from the CDC and just about every publication that you can see, is quarantine in your home. How do you do that when you don't have a home? Think about that. There's no possible way for people to quarantine in their home when they're homeless. Overall, homelessness decreased. We know that. We know family homelessness decreased. We know veteran homelessness decreased. We know chronic homelessness increased. We know unsheltered homelessness increased and is moving around in our continuum of care. or our area, Dallas and Collin County. Even while outreach teams made more referrals from the streets, outreach teams are working very hard out there, and they're doing the best they possibly can with what they have. We've got to create a better system there, and we'll talk about that in a second. Homelessness decreased in the ages 25 to 34 and 45 to 54. And finally, earned incomes are not increasing. Why? This is the question I get most often. When I'm out in the community and people hear the work that I do with Metro Dallas Homeless Alliance, the question I get most often, Carl, is why are people homeless? Why is our homeless population this way? Why is our homeless population that way? Well, I've told you some of the things that we know, so now I'm going to try and give you some of my initial thoughts on what we're seeing in our homeless population or have seen over the previous year. Number one, overall homelessness decreased. Some services are working. That's what I would say. Some services are working. We have to pinpoint those. We have to identify those. We have to do a deeper dive. We have to figure out what exactly is working for who and why and how. We've got to use our data. We've got to use our assessment systems and our assessment mechanisms to be able to do that deep dive. Family homelessness decreased. Diversion, I think, is one of the main reasons for family homelessness decreasing in the number this year. It's working. When diversion is done well, it can work. And it has, in fact, I would argue, started working. The veteran homelessness decreased. Focusing efforts on this population is working. There are still resources for veterans. We are in the middle of a 100-day housing challenge for homeless veterans right now. And our goal by the end of 2020 is actually to end veteran homelessness. And because we've decreased veteran homelessness this year, it shows that if we focus our efforts on this population specifically, it will work. We can do this. Chronic homelessness increased. We still don't have enough permanent supportive housing units or turnover in those units. One of the programs that we're working on right now, and unfortunately we couldn't get it started before the point in time count. We were trying but could not get it off the ground, is what we call a move-on project, where we try to move people out of permanent supportive housing units whose only reason for being in the unit still is because they can't afford it. We have some mainstream vouchers through our public housing authorities, and I want to say thank you to them for partnering with us, with Metro Dallas Homeless Alliance and all of our providers on this move-on initiative to try and move people out of these permanent supportive housing units, because we do not have enough yet. It's clear. Unsheltered homelessness increased and moved around, even while outreach teams made more referrals to housing. Our outreach overall in the community is not solving our problem of unsheltered homelessness. It's not solving the problem. Outreach workers are working hard, and this is not indicative of any specific outreach team or outreach worker, but overall, our system that we have for outreach in Dallas and Collin County is not solving a problem. What it looks like more than anything is we're moving people around. We're moving people from block to block, from community to community, from neighborhood to neighborhood. But so far, that's about all that we're doing, or what we're doing most effectively with outreach, is just moving people around, and that's not solving our problem. Homelessness decreased for those ages 25 to 34 and 45 to 54. Adding rapid rehousing services is working for these age ranges. I think that's, again, my initial thought on why this is decreasing in these specific areas, is because these specific age ranges, particularly the 25 to 34 age range, are a lot of able-bodied people who will never be able to access permanent supportive housing, and so their only option is rapid rehousing services if we want to get them back into the community, into being productive citizens for us. Earned incomes are not increasing. The COC, and I will take some responsibility for this as one of the leaders of the continuum of care, but the COC has not figured out how to do this yet. We have not done a good job. which is one of the reasons why we're implementing an employment and income committee to work specifically on this problem that we're having, that we've had in our continuum for some time now. We've got to solve this problem. We've got to figure this out. I know there are people in the community, there are partners, and there are providers who have figured this out and know how to do this. We just have to tap into that and figure out where they are and how we can replicate those same services and programs here. The School of Coronavirus. So it's obvious that we're in a different time right now. We don't know how long we'll be dealing with the coronavirus, what the effects will be, what the long-term effects will be, or even what the short-term effects will be next week, next month, into this year. But there are some things that the coronavirus is teaching us. And I want to highlight those as actual positives we may be able to take out of this, even though we're struggling going through it right now. Number one, it is teaching us to look out for everyone in the community. It is teaching us that as a community, we can and will go to great lengths to keep each other safe. You all are sitting at home. I am sitting here with CJ and David Gruber, and those are the only two people in the room. Have you ever tried to tell a joke to two people in the room who don't laugh? It's not going over as well. Let me tell you that. But it's teaching us that we'll go to great lengths to keep each other safe. It's teaching us that our community is only as strong as the weakest in our community. One person can make a huge difference in our community with coronavirus. It's the same thing with homelessness. It is teaching us that we are all connected to each other. So while in our day-to-day lives before coronavirus, there were a lot of us that walked around thinking, oh, this problem doesn't pertain to me, this problem doesn't pertain to me. This is a stark awakening, and this is the coronavirus teaching us that we are all connected. It is teaching us that a home is more than four walls and a roof. A home is healthcare. Again, I go back to CDC's guidance in most of the documents they have, which say quarantine at home if you're feeling symptoms of coronavirus. Really? It's public safety. It's not just about the individuals getting sick themselves, it's about them getting everyone else sick in the community. And if they don't have a place to quarantine, where do you think they're going to be? In the community. They don't have any other choices. Our service providers right now are doing a fantastic job of containing everything they possibly can within our homeless community. It's teaching us that home is family. It's a place we go for refuge. It's a place that we go to get love and care and respite. It's also teaching us that a home is community. And finally, the biggest lesson, and maybe all of these lessons combined, is the School of Coronavirus is teaching our community how to end homelessness. If we use these same principles, if we follow these same rules, if we use these same guidelines, if we use these same ideas and values to end homelessness, we will do so. We can use the same things, our connectedness, our community, the strength of our community, the lengths that we'll go to. We can do this. And this is one of the things that coronavirus is teaching us. Strategic planning. So now I want to go over some recommendations that I think we'll need to really take a look at over the next year. These are not set in stone. These are just initial thoughts, just like, again, a snapshot of the point in time count and the state of homelessness address. But these are places that I think we need to look at and need to set a path for us in the future as we move forward to end homelessness in Dallas and Collin counties. My recommendations for our continuum of care or our homeless service providers: we need to bring diversion up to scale. It's obviously working for some populations. It's working well. We have to do it in more places, and we have to become more effective at it. Improve outreach to ensure better consistency and effectiveness, not just moving people around. We've got to get away from this notion of moving people from block to block who are homeless, and we've got to figure out a way to be able to make it more consistent and more effective when we do outreach. We need to analyze how rapid rehousing is working and replicate it and find out, is it with certain subpopulations? Is it with certain people? Is it with certain individuals? Is it with families? Who is this working for and why is this working for them? We need to end veteran homelessness already. It's overdue. As a veteran of the U.S. Army, every single time I see the word veteran and homelessness or homeless veteran beside each other, it makes me a little sad inside, I have to say. I know those are my brothers and sisters that are out on the streets, and I know we have to do something for them. And the thing that gets me is we can do something for them. We know that the veteran population still has resources that we haven't tapped into yet, and we haven't done something for in our community. We know we can do this, which is, again, why this year, one of our goals in our continuum of care is to end veteran homelessness in 2020. And I am absolutely positive that we can do this. We need to develop a data dashboard for the community. And again, I want to apologize to those of you who have been looking forward to a data dashboard for some time. As we've gone through our transition with our homeless management information system, it's been a little more painful than we would have liked, and it has not given us the opportunity to put it out there yet. But we're getting very, very close. We have a system performance committee that is working on it, and we're very close to being able to put that out there. But we have to just get it out there to the community so you can see what's happening. So you don't have to rely on my face every year sitting here telling you about our state of homelessness. You can see for yourself. You can see it on a day-to-day or month-to-month schedule, and you can see what's working and what's not working. We need to do a deeper system analysis with the best tools that are out there. Communities, agencies, federal, local, they're creating fantastic tools. They're creating fantastic system analysis, reports and tools and ways to be able to dig into our data and dig into what's working and what's not, far more than we have ever had the capability to do in the past. We need to utilize those. We need to figure out how to help the people we serve increase their income. We have got to figure that out. And again, obviously we haven't done this yet, and this is something that we have to have a serious discussion about because it really is going to impact how people are able to maintain their housing once we get them moved in. The government or elected officials, here are my recommendations for things that you should be looking at doing over the course of this next year. Develop a way to build affordable housing in all areas of our counties. We need affordable housing. We need affordable housing everywhere. It can't be about not in my neighborhood. It can't be about not in my city. It can't be not in my county. We need it everywhere. We need it for everyone. We need it for our subpopulations. We need it across the board. We've got to figure out a way to be able to do this together and to have affordable housing everywhere. Remove barriers for landlords and property owners to be able to work with homeless service providers. There are some barriers. We've been talking with landlords more and property owners more, and there are still barriers out there, particularly around things like the vouchers that we have that come from our public housing authorities. Sometimes the landlords and property owners honestly are telling us they don't want to deal with the vouchers, particularly because of bureaucracy. It's not because they don't want the money or don't want to help us house our people. It's because they don't feel like they can deal with the bureaucracy. And so we've got to come up with ways to remove barriers for them. We've got to be strategic about how government funding is spent. It needs to align with the goals of the homeless response system. We can't allow government funding to be a one-off any longer. We have to make sure that everybody is moving in the same direction and we all have the goal that is working towards ending homelessness. We need to require that anyone who uses government funds share information with the Homeless Management Information System. Notice I'm not saying that they have to use it as their only source. I'm saying share it with us. We have ways now through our new HMIS system, we have ways to be able to import data, to share data back to those individual sources. And we need to make sure that the agencies that are using government funds are also tied into that system. The only way we're going to know how we're doing better and how to do better is having more information. We'd like our government officials to model collaboration and community-first approaches. Rather than taking this is only good for my council district, or this is only good for my neighborhood, or this is only good for my area, we need you to look at it on a more global scale. We need you to model collaboration like you're doing now with the coronavirus. I have yet to hear anyone on city council or the mayor talk about one council district getting some specific coronavirus, testing or research or some other resource that every other city council district hasn't had the opportunity to get. You're doing it now, and we want you to continue that. We want you to continue that for homelessness. Educate yourselves, your colleagues, and your community about homelessness. I've tried to give briefings, and I have given briefings to City Council and the Citizen Homelessness Commission and other elected officials individually, and I appreciate that. Anytime an elected official reaches out to me and asks for information or to verify information or make sure of the accuracy of information, I am more than happy to sit down with them and talk to them about that. We need you to be educated. We need you to understand our system and understand what works and what doesn't. Listen to the experts and give them the opportunity to help make good decisions. We have experts here. A lot of our homeless service providers have been in this field and working with homeless individuals for a long, long time. They know what to do. We know what to do. Listen to the experts. Follow our guidance. Listen to what we're saying and give us the opportunity to help you make good decisions about our community. That's what everyone wants, is we want the best decisions made on behalf of our community. And finally, the community. My recommendation to the community: create a funders collaborative to create larger collective impact and to focus funding on big changes for the system. The homeless service providers individually can make changes to individuals and families on an individual level. But in order to make those big system changes, in order to build 1,000 units of housing, we need funders to come together in the community. We need resources to be pooled. We need to put them together and have a large impact, not a 25 here and 25 there. We need a larger impact from that group. We need community champions to help us get everyone moving in the same direction. As I'm looking at this, you know who you are. We are ready for you to step up. We are coming together. The providers are ready. The elected officials are moving in that direction. We are getting everybody on board. It's time for the community champions to step up and help us with these initiatives. Be strategic on how you spend your resources. This goes down to the individual level who makes donations and who devotes their time and energy to our homeless service providers. Encourage any organizations where you volunteer or donate to join the continuum of care, just to be part of the system that's moving in that direction. If they're not part of it already, ask them to reach out to us. We'll make it very easy for them to join. We want to make sure that everyone is moving in the same direction, and we want you as a community to help keep us accountable to moving in the same direction. Advocate for more affordable housing and funding for homeless service providers. We always need more funding, and right now we always need more affordable housing. We will let you know when we have too much, believe me. I don't think we'll get there anytime soon. Ask your elected officials to be part of the efforts to end homelessness. Elected officials want to hear from the community. I've spoken with several elected officials who have said to me, what do you think my community members in my council district or my neighborhood will think about this? They want to hear from you. So if you have ideas about or just encouragement about ending homelessness and being part of the solution, please reach out to your elected officials and let them know this. They want to hear from you. Don't blame homeless people for system failures. It doesn't matter if it's the gentleman who's pushing a shopping cart on the street, or if it's a child who is in school right now, who's staying at an emergency shelter. It doesn't matter who it is. We don't need to blame the individual homeless people for our system failures. It's not their fault, not on a grander scale. Yes, some of them have made poor decisions, and they will be the first ones to tell you that. But they're trying to turn their lives around. They're trying to do better, and they're trying to become productive, positive citizens in our community. So it's time to stop blaming individual people. Know that ending homelessness is better for everyone in the community. It is. If you want better teachers or better students for teachers, then we need to end homelessness for children that are homeless right now. If you want better citizens for our police officers and firefighters and first responders, they will do better responding to someone who is housed than someone who is homeless because of all the challenges that go along with that. We are all connected, and ending homelessness will be better for every single individual in this community. I saw this quote recently from Confucius, and I think it really speaks to where we are right now. The strength of a nation derives from the integrity of the home. Think about those that do not have a home right now. Think about those who are trying to stay well, stay healthy, get fed, stay alive. Right now, they don't have that home. But we as a community, we can create that for them. And it will make all of us stronger as a community if we can ensure that the integrity of everyone's home is stronger. Finally, I want to talk about the will of the people. Ending homelessness, some people will tell you it's not complex to figure out what ends homelessness. We know that's housing. We also know what programs, what models, what evidence-based practices work in our system. We know that there's a lot of things that can be done, and we know that we know what it is that we need to do. The question is, do we have the will? So my question right now, as I wrap up my presentation, is, will Big D see us all as one? Is Colin all in? We have shown that we can end homelessness. We have shown that we must end homelessness. We have shown our unity to end homelessness. The only thing left to show is our will. Will we show everyone what makes us here in North Texas the best cities, the best counties, the best state in the best country? It is time to show everyone that we will end homelessness. Thank you very much. Please stay safe out there. I'll take some questions now. All right, let me see if I can get this to work. All right. The first question, let's see. If you could be granted 3 wishes from the Texas State Legislature this year, what would they be? Woo, okay, fantastic. We're getting into wishes already. The 3 biggest things I think that I'm looking for from the Texas State Legislature this year would be, number 1, a housing trust fund that is real for the state of Texas. Right now, I believe it's still somewhere in the neighborhood of 1/10 the size of Florida's housing trust fund. That to me is unacceptable. Again, the best state, if we're the best state, then why does Florida have a housing trust fund that's 10 times larger than what we can do in Texas? So that's number 1. Number 2, look at the policies and the regulations that are keeping people from creating affordable housing. There may be legislation out there that is a barrier to people building affordable housing for us. And number 3 is resources, is listening to our providers for the resources, particularly in light of the coronavirus. There are providers out there right now burning up their resources that they were going to use going into the rest of this year on fighting and ending homelessness. We need to be aware of that from the state legislative perspective, and we need to figure out a way to make these providers whole who are using up their valuable resources right now, just trying to contain the coronavirus. Question 2, how can we prevent homelessness resulting from businesses closing or slowing down? How can we prevent homelessness resulting from businesses closing or slowing down during the coronavirus pandemic? How can we prevent homelessness? I think right now, the biggest thing is to get through the coronavirus first. We understand a lot of the things that I've outlined this morning, that I've talked about, a lot of the recommendations, they're not going to happen in this environment. It's really difficult right now for us to get any traction, if you will. So right now, the biggest thing is listen to your providers. They're all out on social media. They're talking with the community members right now. Listen to what their needs are during this coronavirus pandemic. And once we get through this as a community, then it will be more helpful for us. But ultimately, I guess the biggest thing is we need to stop evictions. If we want to prevent homelessness while all the people are out there and they don't have jobs or they don't have the means to be able to pay their rent, we need to stop evictions. There have been several communities that have put moratoriums on evictions currently, at least during this time frame. Again, think about what the guidance is. Stay home, quarantine at home. Why would we want to make it harder for people to do that in the middle of this pandemic? Question 3, how can nonprofit agencies get involved? Wow, okay. It depends. I've laid out some ways. The community, it depends on if you're a community nonprofit agency or you're a homeless service provider nonprofit agency. If you're a homeless service provider, if you provide services to homeless individuals, become part of our continuum of care. Become part of our network. Work with us so that we don't have to worry about any ancillary troubles or issues that we run into. We love having our homeless people fed every day. We think that obviously it sustains them from a nutritional standpoint, but we also know that if we have everyone drive down to the middle of downtown Dallas and open up their trunk and throw sandwiches out at homeless individuals or hand sandwiches out to homeless individuals, that there's usually a lot of waste that goes along with that. A lot of paper napkins or styrofoam containers or things like that, that the people sometimes who hand out those sandwiches aren't even thinking about. And that just makes it harder for business owners and for the community to really understand how we can get more of those people into housing when we have to deal with things like litter and trash and people congregating in areas where they shouldn't be congregating, things like that. So if you're a nonprofit agency that works with homeless individuals, please work with us. Join the continuum of care, come to our meetings, be part of our network, and listen to what we have to provide. We have other alternative ways for you to help us and to help homeless individuals that we think will be more effective. Just reach out to us. Sorry, hold on one second. Let's see, question 4. How is the Veterans Housing Challenge going? And how has it been impacted by the coronavirus pandemic? That's a good question. It is going slower than we would have hoped at this point. As of the last count, we had definitely moved in 10 homeless individuals or homeless veterans into housing, but we also had 35 homeless veterans that had or were in the process of getting either vouchers or housing assistance. So I haven't got the most current information yet. We'll make sure and post that where we can and get that out to everybody. But at last check, there were only 10 individuals housed and 35 kind of in the pipeline, if you think about it that way, towards getting housed. And I don't know how many of those 35 have actually been housed. But it's certainly slowing down. We know that there are housing authorities who are, because of the coronavirus, having to scale back their meetings to get people into vouchers, or having to scale back any other types of services that might have helped us get people into housing faster. We're asking people to, hold with us, to work with us and be patient with us as we continue to work on this. But we are still trying to get homeless veterans housed. We're still trying to do it. How are you addressing youth homelessness? Youth homelessness is one of the subpopulations that we have to get more information about. On the youth homeless count was actually scheduled for April 3rd and 4th of this year, and it had to get postponed because of the coronavirus. We're hoping that they'll do that sometime later in the summer, and that will give us more specific information about youth homelessness. But when I talk about homelessness and ending homelessness, I mean for everyone. It is not just one population or one subpopulation. I'm talking about ending it for everyone. We have a youth committee and a youth advisory board made up of formerly homeless and homeless youths that are giving us direction on a constant basis. And they are telling us the things that we need to keep adding to our system. And so we're looking at all of those things and trying to figure out how we can add every resource that we need in order to address not only youth homelessness, but every subpopulation of homelessness that's out there. Do you have more information about the families who are doubled up and how we can prevent those children and youth from becoming homeless? Unfortunately, I don't have that information myself. I'm sure that Dallas and Collin County school districts have those statistics and have more information about them. Our plan is to work with them around prevention. It's one of the reasons that I reached out to the Child Poverty Action Lab and went to a recent meeting they had about housing, is because they're looking at how to prevent evictions. They're looking at the low-income individuals who may have housing or need better housing. They're looking at that population of people who are, if you want to call it upstream, who have not become homeless yet, but are on the fringe or almost homeless, as we might call it. We're looking at that. We're working with those partners. We're trying to figure out how we can get further upstream on that. But as you can see, there are a lot of things that we're having to work on, which is why we need more community involvement, more help, more partners to be part of this solution, because we've got a lot on our plate and we're trying to handle all of those things and also reach out to those partners upstream. But ultimately, most of our partners upstream are going to be the ones that are going to have to give us more direction on how we can prevent homeless families and children that are doubled up from becoming homeless. How important is having all partners, nonprofit, city council, county, dedicated to one strategic plan to end homelessness? What challenges do you see here in Dallas in achieving this one voice? How can we overcome these challenges? That's a good question. At this point, and again, I would point back to the coronavirus. If it's important to us and it's the will of the people, we will end homelessness. There's no doubt about it. We know how, we know what's working, we have an idea what's not working. We're committed as the homeless service system and the homeless service providers to do whatever it takes to end homelessness. So in terms of the partnerships and getting everybody on one plan and everybody moving in one direction, that's where we're trying to work on now. That's where we need your help. That's where we need everything to come together. We think we have some ideas in the coming weeks and coming months that will help us solidify that and make it a little more formal in terms of how we can bring everyone together towards one common objective or one set of objectives. And we do have the D1 plan out there right now that we're working on and we're working on implementing. It may be part of the solution, it may be all of the solution, but we have to come together as a community. We have to decide that. We have to figure out what that plan is. And part of it is the community talking with us and getting involved with us. As I said in my presentation, we are going to have opportunities for more community members, more elected officials, more nonprofit agencies to become more involved. As you see those, if you are plugged into our network, you will be alerted to those. My question to you, and my question as I leave you now, is will you step up? Will you do this? Will you help us end homelessness? Thank you.